One study that makes a drug look like it's very helpful. Now, this was a good study. It appears, it has not been peer reviewed, but at first glance, it looks like it was a well done study. The second part of your question had to go to hospital occupancy, and so this is an important question because we already have a number of hospitals in the Houston area that are saturated, LBJ and Ntuba in particular, and we have others that have been saturated and then their condition improved a little bit and they've been saturated again. And the point is that across the region, in fact, even just within the county, we do have a lot of empty hospital beds, but these hospitals don't all fill up at the same rate. And so right now we began working earlier on this week, and we're working continuously with CETRAC, which is Southeast Texas Regional Advisory Council, and the hospitals and the TMC member organizations in particular to help try and balance the load across the hospitals. And I will share with you that while that sounds like a great idea, and it is not necessarily easy, especially when you consider that some of these patients are very, very sick, and moving patients who are very sick has its own risk with it. And so it's not a quick and easy solution. But the good news is that the hospitals are working together quite clearly to achieve that. The issue will then be, which I think goes to the last part of your question, was that what happens if we should get to the point where then all of the hospitals are full and there are no beds available. So theoretically at that point is when the hospitals would start activating their surge plans, of which there's 2 levels. First level is that they would take within their own buildings, they would go into areas of the building that they don't usually use for patient care, they would do that. And the second part is when they would go to new buildings, for example, maybe an empty nursing home or a previously unoccupied hospital or even an office building, and try to build that into a hospital. The problem with that is that even as you do that, unless you get a shipment, wrong term, but you get a whole bunch of new doctors and nurses and respiratory therapists and pharmacists and x-ray technicians, and you go down the whole list, you can quickly fatigue your staff by using the same.
You used the word saturated.
So we have between hospitals and ambulances, the term that we use is that they're saturated. We used to use the term diversion when hospitals would divert ambulances or try to divert ambulances. It's just a terminology. What it means is, and the hospitals can indicate that the U is saturated. Basically, saturation means that the beds are full.
And is that the case at which?
Right now, it's LBJ and Ntuba, but others have been on saturation and have come off. I don't want to name any names because right now at this moment I would probably name one that's not saturated and they would not be happy with me for saying that. But the point is that there are several hospitals. So within the city of Houston, the Houston Fire Department transport patients to about 44 hospitals in and just outside the city limits of Houston. And so we've had about 6 have been on diversion or on saturation right at the same time, which is not uncommon in January, but it's very uncommon in June.
Question for the mayor. You had police hand out masks and avoid issuing citations.
Yes.
When there was a violation. Would that be your approach again if there's some sort of new mask order imposed?
Yes. People were coming out to the mask distributions and they were asking for those masks. And it would be the same approach now. Sometimes people knowing that they're required. And let me just say, this has nothing, nobody's even talking about any jail time. Okay, so I don't even know where that came from. Nobody has any
So no fines, right?
No fines. It's about giving out the masks. And when people know that they're mandated, it's amazing. It's just knowing that I am required to have one. And knowing that they were required to have one, they were coming to get them. But once that requirement was gone, they stopped coming.
And just to be clear, you said about this and she's considering a new order, but it's
We spoke very quickly. The governor indicated that the county judge in Bear's order was fit within his, what's the word I'm looking for? Fit within his purview and was allowable. Then the county, I think, is called to see, my feelings on it. So we're discussing it.
Okay. Now there's a couple out there.
Okay. Okay. Non-COVID.
Thank you. Question asked, when do you expect the downlink statue to be moved?
Just
Soon. Got it. Houston.
yes.
2-part question here. What does it mean to have them invest in Houston? And with the downturn of COVID, how symbolic is it to have this investment during the current economic climate?
Number 2, we've been focusing quite a bit on our startup technology and innovation ecosystem. This will add to establishing a very integrated, robust ecosystem. We had always, Google was one of those entities that we had been targeting.